This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine. We care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome to Mon Health Talk on WAJR, and welcome to a new week of programming here on WAJR as we're into the month of December. I'm Kyle Wigg sitting in for Dave Wilson. Dave will be along here at the top of the hour with the talk of the town for this Monday morning, and he'll also be filling in for Hoppy on Metro News Talkline today. So there's a lot to get to, so let's jump into it and get started. We've got two guests on Mon Health Talk this morning. One is a veteran guest, Dr. Jaschar Rad, urologist and robotic surgeon from Mon General Hospital and the Mon Health Network. Dr. Rad, good morning. Thanks for coming on.
Good morning, Kyle. Always a pleasure being here on your show.
Yeah, we indeed. We enjoy having you back. And Dr. Parag Chaudhari is with us as well. He's a hospitalist with Mon Health. And Dr. Chaudhari, good morning. Thanks for coming on.
Yeah, thank you. Good morning.
Define what that is. What is a hospitalist?
So actually, I'm a pulmonary and critical care physician. So I take care of patients who are critically sick in ICU. That's where I spend half of my time. And the other half of my time I spend doing advanced bronchoscopic procedures, mainly for patients who have lung nodules or lung problems, which need biopsy of the lung tissue. So we do a lot of different procedures. Recently, we started robotic bronchoscopy, but in addition to that, we do EBUS, with which we can biopsy lymph nodes, and we also do some biopsies of the lesions inside the airways as well. So that's what I do at Mon General. Okay,
so you're a lung specialist. That's one of the things that you know a lot about. And, of course, Dr. Rad, a urologist. And we're going to talk today a little bit about the Monarch Robotic Surgery technique. But before we do that, let's, of course, Dr. Rad, you've been on here many, many times, and people know that you're a native of the state from Parkersburg, correct?
Correct.
And Dr. Chaudhari, why don't you give us a little bit about your background?
Yeah, sure. So I'm from India. I did my med school back in India. I moved down to U.S. back in 2010. And I did my internal medicine residency at LSU in New Orleans, and subsequently did my pulmonary and critical care training at Tulane University in New Orleans as well. Moved down here in 2018. My wife was planning to go to WVU. So, and that time, I was also looking for a job down here. And fortunately, Mon had an opening, and I've been here since then. And this has been a fantastic place to work here and be here. It's really very fortunate that I'm able to take care of patients here at Mon.
Mm-hmm. Okay, November, of course, we moved into December, but November was Lung Cancer Awareness Month. So let's get into that a little bit. Lung cancer awareness. Dr. Chaudhari, again, that's one of your specialties with the lungs. You mentioned that. What type of screenings do you offer? What type of things do you suggest? And are there symptoms for people who may think they may have an issue in terms of lung cancer?
Yeah, so, when it comes to lung cancer, unfortunately, patients, when they start to develop symptoms due to lung cancer, they are usually in advanced stage. So back in 2012, there was a national trial done to see how we can detect these patients early on, and we came up with something called low-dose CT scan. And it's basically a CT scan of your chest, but we use a lesser dose of radiation. And patients who are between age group 55 to 77-year-old and who are currently smoking or have quit smoking last 15 years are eligible to get this low-dose CT scan. And with this low-dose CT scan, we are able to detect nodules much early on in the process. The other thing that we face challenge with lung cancer is majority of the patients, when we diagnose them with lung cancer, they are in advanced stage. So with low-dose CT scan, we are able to diagnose very early in the process. We're able to do biopsy of these nodules, and if they are very early on process, they can also have a cure of the lung cancer. So very essential that we focus a whole lot on getting patients screened for this for cancer. Mm-hmm. And as I told you, for lung cancer, the symptoms really don't present until the cancer is very advanced. So the only way to screen them is to do yearly CT scans in patients who are eligible. And at Mon, we offer this. They can reach our pulmonary clinic, and they can also reach us on our Mon Health website at monhealth.com/lung cancer, and just fill out a simple questionnaire, and that will tell them if they are eligible for lung cancer screening or not.
Okay, doctor. I'm sorry. Go ahead.
Yeah, so that's how we would be able to help patients with lung cancer, detect them early on.
Mm-hmm. Dr. Rad, anything to add to that?
Yeah, I think, it's important to just realize that screening really saves lives. If you talk about any cancer, lung, breast, prostate, colorectal, you really have to follow with your family physicians, listen to their recommendations, and get screened, because the sooner we find a problem, the easier it is to fix it, and we don't have to chase the problem down the road when it's maybe too advanced or too late.
Mm-hmm. You mentioned cancer screening. This is slightly off the topic, but Dr. Chaudhari talked about the lung cancer screening. For the other screenings, you mentioned colorectal cancer. Men and women over a certain age probably need to, to submit to that procedure and get themselves checked out. And I know, Dr. Rad, men of a certain age need to know their number. They need to know that PSA number in order to detect early-stage prostate cancer.
Correct, yes. Age 50 is an easy thing to remember. Once you hit age 50, there are certain things you should do as both in males and females, and also for breast cancer, there may be some screening that's needed earlier. Family history plays a major role, so if you have a family history of any of these cancers, definitely get screened a little sooner, and that your physician is going to be able to recommend the specific age for the specific problem to you. Prostate cancer, we use PSA screening, which is a simple blood test, as well as a physical exam, starting at age 50 in most men, or earlier if you have a family history. The PSA number, has different ranges, but if you're in your 50s and your PSA is in the 2 to 3 range, it may be a good idea to start following with a urologist who can monitor you moving forward.
Mm-hmm. Okay, let's talk Monarch. What is it? Dr. Rad, let's start with you. I know you've been advertising this procedure on our radio station and I'm sure in other media forums, but the Monarch Robotic Surgery procedure, what is it and what are the advantages?
So, as everyone knows, I'm a urologist, obviously, so why am I here talking about lung cancer? Well, as a director of the Robotic Surgery program at Mon Health, my goal and the goal of our team is to provide the latest technology that really can make a difference in patients' lives. We don't just acquire technology for the sake of having it here. It has to make a meaningful, it has to have a meaningful impact. And the Monarch Platform takes us to the next level in terms of allowing us to biopsy patients with lung nodules earlier while reducing side effects or the complications. CT guided biopsy has been around for a long time and is one of the first lines of biopsy for a lot of patients. We also already mentioned he does electromagnetic navigation biopsy, and that has been around for some time. Both of these traditional ways have their risks and benefits, and the risk of the CT-guided biopsy, it has a high complication rate with something called pneumothorax, so a dropped lung, where the needle goes maybe in a spot where it's not supposed to, and the lung deflates. With electromagnetic navigation, the yield, getting a good biopsy, the rate of that may drop significantly, while the complication rate is less. Monarch combines these two procedures and allows us to have high yield, so get good biopsies, while reducing the complication rate significantly. And so therefore we brought this to West Virginia, where lung cancer is very prevalent. West Virginia has the highest lung cancer rate in the country.
Wow, that's kind of startling. Really not surprising, but a little bit startling. Dr. Chaudhari, how does this make what you do in terms of detecting lung cancer and treating lung cancer? How does this technology ease your job?
So as Dr. Rad was telling, we had different technologies before, but the main limitation with using a traditional bronchoscope to reach to the nodule was it was limited with the dexterity of your hand to get to the spots. And, with previous bronchoscopes, you couldn't just make those sharp turns inside the lungs to get to the spot. The robotic scope, on the other hand, it's controlled by the physician, but it helps make you those precise movements once you're inside the lung. And with that, you're also able to reach way further into the lung tissue and get biopsies of the spot, which we were not able to do before. This is going to be a big game changer, the robotic bronchoscopy, because what we are going to do in future, and it's under investigation, is once you detect the spot in the lung, you biopsy, you have a diagnosis, maybe in future we would be able to burn this tissue in the same setting, and patients can have diagnosis and treatment and maybe a cure in the same procedure. So it really helps to reach to the spot which are way further inside the lungs and get to them, which were not accessible before with traditional technologies available.
Mm-hmm.
Now, we also combine our robotic bronchoscopy with a different sort of scope we call EBUS. And with that, we are able to scan the lymph nodes inside the lungs, and biopsying these lymph nodes tell you what stage the cancer is. So when you combine both of these technologies, you are able to help patients not only diagnose but stage the cancer, and maybe in future also provide therapeutic options as well for treatment of lung cancer.
Dr. Rad, this platform, this surgical platform, just recently approved by the FDA, and Mon Health Medical Center is the first in this region to have this technology, correct?
Correct. We are the first hospital in North Central West Virginia to acquire this platform, and we started offering it to the patients in August of this year. We've had great success with it, and Dr. Chaudhari mentioned currently is in trials for a treatment that can be offered through the platform, meaning that once the lung cancer is diagnosed on the same day, you can actually treat it while the patient is still on the table. And that's going to be a game changer, I think, for many patients because now you're combining modalities. Patients don't have to come back multiple times, undergo maybe a big open surgery. They can just have their lung cancer diagnosed and treated at the same time. And we'll be the first and the only ones here in the region to have that.
Okay. So with this advanced technology, you expect to have to go to somewhere like Pittsburgh or maybe the Cleveland Clinic to receive treatment like this. You can get it right here in our community in North Central West Virginia and in Morgantown. Dr. Chaudhari, how important is that this has arrived here?
Yeah, this is very, very great, because, most of the time patients that we get, they come from, further away, and to get this technology in our state and to help them, it's a tremendous benefit for the patients around here. They are able to get the most latest advanced technology right at Mon. So it's definitely a big push and help to the community. And we are very glad that we are able to get this to our people here and help them.
This is Mon Health Talk for this Monday morning. We invite you to stay tuned. We need to take a quick break. We will continue the conversation, lung cancer screening, and the Monarch robotic surgical platform, what it all means. That's our topic today on Mon Health Talk. We'll return on WAJR after this. Stay with us.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. We've got a few minutes remaining with our guest, Dr. Jaschar Rad, Dr. Parag Chaudhari from the Mon Health systems, and we're talking about the Monarch Robotic Surgical Platform. And gentlemen, welcome back to the show. We appreciate your time again. We've got a few minutes left, and Dr. Rad, I know we've been hearing in recent years about robotic procedures for cancer surgery, prostate, ovarian, etc. How is this technology? Is it the same? If not, how is it different?
So that's a great question, Kyle, and I think patients are going to hear more and more about robotics in various shapes and forms in different fields of medicine. In robotic surgery, and I'm actually giving a presentation to medical students later today about this, we're talking about a piece of technology that allows us to do something that we used to a little bit better. With cancer surgeries, the Da Vinci robotic system was developed to help us reach places in the body that were difficult to get to previously and do a better job for our patients. Platform allows us to do surgeries with prostate cancer, kidney cancer. You mentioned ovarian cancer. In gynecologic diseases, we can use it, and many others. General surgical procedures are now being done with the Da Vinci system as well. The Monarch Platform was actually developed by the same physician who developed the Da Vinci system, and the goal was to go somewhere else in the body that we couldn't get to before, and that was the lung. Now, the lung is, very, very challenging to get to with traditional procedures that we had available, as Dr. Chaudhari mentioned. And this platform now allows us to reach far beyond the places we used to be able to get to, and by using it, we can provide better care. Now, this technology is going to get developed more and more. We actually use Monarch in different settings outside of lung cancer. We're going to be able to use it in certain urologic procedures in the near future. In gastrointestinal procedures, we are going to be able to use it. So the device is going to have expanded indications. We're also looking at other robotic systems for our community for various other disease processes here over the next year. The important thing for patients to realize is that you don't have to travel necessarily outside of our community or West Virginia to seek this kind of advanced care any longer. Stay here locally, get treated by people that live in your communities and care for you as if though you were, one of our family members. Mm-hmm. And at Mon Health, the logo, the slogan says, you feel the difference, and we really try to make sure that you do.
Mm-hmm. Dr. Chaudhari, again, how do people get involved with this? How do they schedule appointments for this Monarch platform, and how can people, reach you in general?
So, they can, contact us to our clinic at 304-598-2801. They can just call there and schedule an appointment, and they can call that number and also get hold of me if they have any questions. The other place they can look for information is on our website, monhealth.com/lung cancer or monhealth.com/surgery. And it will provide them a lot of information about how they should go about getting themselves checked out, and also to get them screened for lung cancer. Mm-hmm. That's basically they can get hold of us through those two sources.
Okay, we got about a minute left, and again, the bottom line here is less invasive and more accurate screenings and treatments with this platform. Dr. Chaudhari. Yeah.
So, extremely. So less invasive and less complications with this procedure compared to other procedures as well. And, you get to not only diagnose but also stage cancer if there is. So very, very nice and new innovative technology that we're offering.
All right, very good. Well, this was very informative, and it's exciting. It's exciting about this technology being here, and it's only going to get better. So that's something that people need to know. And doctors, we appreciate your time this morning. Thanks for coming on and informing us about this service.
Thank you, Kyle. It was a pleasure being here.
All right, very good. Dr. J.S. Rad, Dr. Parag Chaudhari with Mon Health Systems. Mon Health Talk for this Monday morning. Again, we appreciate their time and expertise, and we, of course, thank you for listening as well on this Monday morning.